Ever wondered if we can reduce the risk of long COVID? Well, a new study brings a ray of hope. That's right. A recent study by the US Department of Veterans Affairs has been making waves focusing on Paxlovid, an antiviral pill for COVID-19. The research involved analyzing electronic health records of over 56,000 veterans who had contracted COVID-19. The exciting finding, Paxlovid, when administered within the first 5 days of infection, appeared to reduce the risk of developing several long COVID conditions by a notable 26%. These conditions included heart disease, blood disorders, fatigue, liver disease, kidney disease, muscle pain, neurocognitive impairment, and shortness of breath. However, it's important to note that the study did have its limitations. The participant pool was largely comprised of white male veterans, and the research only considered 12 long COVID conditions. Nevertheless, the results certainly offer a glimmer of optimism. Paxlovid, a combination of nirmatrelvir and ritonavir, has been showing promising results in reducing the risk of hospitalization and death in people at risk of severe COVID-19. So, what exactly is Paxlovid and how does it work? Let's delve into the specifics. Paxlovid, an antiviral medication, is a product of Pfizer and is administered orally over a period of 5 days. It's a combination of nirmatrelvir and ritonavir, and the magic happens when it's taken within the initial 5 days of symptom onset. You see, this is when it's most effective in reducing the risk of hospitalization and death in individuals at a higher risk of severe COVID-19. And it doesn't stop there. The National Institutes of Health has plans to study Paxlovid as a potential treatment for long COVID. This means that the drug could not only help in the initial battle against the virus, but could also reduce the lingering effects that some patients experience long after their recovery. With Paxlovid showing positive signs, the fight against COVID-19 seems to be getting a new weapon. Let's take a quick recap of the important insights from this study. Researchers at the US Department of Veterans Affairs delved into the effects of Paxlovid, an antiviral pill for COVID-19. The study spanned over 56,000 veterans with COVID-19, with over 9,000 treated with Paxlovid in the early days of infection. Findings indicated that Paxlovid reduced the risk of developing several long COVID conditions by 26%, a significant step in the fight against this pandemic. However, it's important to note that no significant link was found between Paxlovid and the risk of cough and new diabetes diagnosis. This study, despite its limitations, opens up new avenues for further research. Paxlovid, a combination of nirmatrelvir and ritonavir, has already shown promise in reducing the risk of hospitalization and death in at-risk individuals. The National Institutes of Health has plans to further investigate Paxlovid as a potential treatment for long COVID. In this ever-evolving battle against COVID-19, the potential of Paxlovid in reducing the risk of long COVID is indeed a breakthrough worth celebrating.